There's no doubt the U.S. is in the midst of a fourth wave of this virus. This time it's driven by the Delta variant.
The strain is behind a surge of cases all over the country and right here at home. Updated numbers from the Iowa Department of Health show nearly 1,400 Iowans were diagnosed with COVID-19 in the past week. An additional 12 deaths were also reported during that same time frame. The CDC says Iowa's positivity rate has climbed to 5.5%. Hospitalizations are up 17%. Hospitals around the country are seeing the same thing.
So every one of these rooms is full?
Every one of these rooms is full.
Doctors at this Miami hospital don't expect the trend to change anytime soon. Florida accounts for 20% of all new cases in the country. Cases and hospitalizations are also surging to our south in Missouri. The Missouri Department of Health issued several hotspot advisories today, identifying 3 counties near St. Louis that are seeing the biggest jump in cases. WHO 13's Kaylin Thompson joins us now. Kaylin, scary situations in other parts of the country. So tell us, what are local hospitals seeing?
Well, Aaron, metro hospitals aren't seeing the surge quite yet, but 2 chief medical officers tell me it's something they're preparing for.
At the height of the pandemic, Unity Point Health had 140 COVID patients. Right now, that number is in the single digits across its 4 hospitals. But doctors know how quickly that can change.
It takes about 2 weeks after cases start to increase before we see the hospitalizations increase. So we're watching that very carefully and knowing that we are already very tight, and we're getting calls from Missouri to transfer patients here because they have no beds left and no ICU beds left in Missouri.
But that doesn't mean beds are empty here in Des Moines. Metro hospitals have been busy caring for patients with illnesses typically seen in the winter months.
The pediatric side, lots and lots of RSV and pneumonia. Adult side as well, respiratory illness, plus all of our chronic illnesses that didn't have as much care during our COVID pandemic.
If more COVID patients are added to the mix, another challenge across the board will be finding the people to care for them.
Currently, staffing for most hospitals in Metro for nursing, OR staff, we are short of the staff. So that would be a worry in future if the COVID patients continue to increase.
Doctors are saying the best defense against the Delta variant and surge in hospitalizations is the vaccine. But with vaccination rates still lagging in the state, healthcare leaders are bracing themselves for what could be.
What's worst case scenario?
We may find out. We do the best we can with what we have and work with our community. I'm in constant contact or in frequent contact with other medical directors and CMOs throughout the community, trying to figure out how do we safely care for these patients.
Doctors say just like the initial wave of the pandemic, it surges in different areas at different times. They tell me part of it now is due to vaccines. Iowa Department of Public Health says 65% of those 18 and older have received at least 1 shot. But doctors are worried about the counties with low vaccination rates, where people are more vulnerable to that severe illness.
Yeah, that's what's getting scary. Thanks for the update, Kaylin.